I am Dr. Qureshi, and today we're doing these videos to go over some of the procedures that we perform at Arkansas Spine and Pain. Our goal here is to help patients get pain relief from different spine diseases and overall pain management from other diseases. There are several diseases that cause numbness, tingling down your arms and legs. So a lot of people have neck and back pain with these symptoms going down their arms and legs. So we're basically going to concentrate today on explaining that what you hear from other people, like pinched nerve, herniated discs. These are very simple things that you hear all the time from different doctors, different things. So we will actually explain those using back and neck models. But before I can get into too much detail of the diseases, I would like to first explain what the models or the anatomy is, so for a person like you who's not in the medical field can understand easily. So I will use a model for back right now. This is a back model, and we're looking at this from the back side. And then if you turn, you're looking at it from the front side through your stomach. You will see this part. So let me explain you what that is. These are the backbones, are called the vertebrae. Now between the vertebrae are the discs, or I call them in a very simple terms, a cushion between the bone. So you always hear that your doctor told you got a degenerative disc, or your disc is worn out. What does that mean? That means basically these cushions or the discs have lost their height or their water from inside, and they have become degenerated. So that's what basically means. From this height, it's gone down to low height. Now when that happens, if I turn the model around, these cushion or the disc pooch back. This is a simple word. So you will hear herniated disc, you will hear protruded disc or extruded disc. So when that happens, if you look at it, the cushion goes to the back. Now what happens in the back, these are the nerves coming out of your spinal cord, which is right in the middle. And that supplies the rest of the body. This is our nervous system. So these are the nerves. When herniated disc goes back and irritates these nerves, that's when a person gets numbness, tingling, pain going down their legs. Or in the neck, same thing happens in the neck. So the pain actually radiates down to the arms. Now it all depends on how bad is the disc. If it is pretty bad, meaning extruded disc, you could have more problems or symptoms than just little numbness, little pain. You could have severe numbness, you could have a loss of reflexes, you can have weakness in your legs or arms when it becomes pretty bad. So going forward, we will keep turning the model around. Now these nerves actually come out of this hole, which is called foramina. Now, foramina, again, can get tight. That's called foraminal stenosis. And now, why does that happen? That happens because you can have development of arthritis around this hole, or your spinal cord ligament, which is ligamentum flavum, can get tight right in the middle. That can cause tightness of the nerve, and that is called spinal stenosis. It is just like the way I explain to my patients. It's like I'm putting my hand around the neck and trying to squeeze. What will happen is you start choking. So now in spinal stenosis, what happens, the patient starts walking, and as soon as they start walking, they start hurting, because the tightness in here where the nerves come out from, it requires oxygen to use, to walk. So everything requires oxygen. Just like think, I'm putting my pressure on your neck so you'll stop breathing. This is exactly what's happening to these nerves. So when you're putting pressure, when you start to walk, you're causing pain. So what happens, you cannot walk far and you have to sit down in order to get relief, because there's so much tightness around the nerve. That's called spinal stenosis. Now going further back, so we've talked about the hole, that's called foramina, and you can have that tightness called foraminal stenosis. You can have a tightness in the back that's called spinal canal stenosis. Now, when I had shown you that these are two backbones and there's a cushion between the bone, if you keep turning around, they in the back sit on each other. So this is one bone and this is the other bone. When they sit on each other, they make a joint back here called facet joint. Now, you could have a arthritis of those joints. So it's called facet arthrosis or facet arthritis. Now, patient can have pain just from arthritis of this pain, of these joints. So how does that happen? When patient complains mainly back pain, not much leg pain, we always think, are they having more joint pain? So there are procedures that we do to identify or figure out if the pain is coming from these joints, which I will explain in a minute. But again, I just want to, right now I am trying to show the anatomy and what it does. Now going further down, these are joints from the neck all the way down to the bottom. And God has made these joints for us to bend forward, backward. Now if you can see how the joints open up when we bend forward, how the joints kind of get tight when we bend backward. Now we have arthritis of these joints. The patient will have pain when I do this, called the extension of the spine. And when I do this, which is opening up the area, you will get some relief. You will also get relief if you look at it in the hole if it's tight. So patients tend to lean forward when they're having pain from the facet joints or the tightness from the nerves coming out, or the spinal stenosis also. So they bend forward to get some relief. So it opens up the area, it gives space for breathing to the nerves. So if you can see, these are the joints all the way from, these are the neck joints, and all the way down to your sacrum. Now, We also have a joint between the sacrum and the hip bone. On the bigger model, I can show you that. So the pain can also be, back pain can also be from this joint where the sacrum or the tailbone meets the hip bone, called sacroiliac joint. So there are procedures that we do for sacroiliac joint or iliac joint. Then there could be a pain from coccyx. A lot of patients complain of tailbone pain. So there is something called coccydynia, which is inflammation of the coccyx joint, for which we can also do injections. So now, I hope you guys understood the anatomy, so I can now explain the type of procedures we do.